I am 30 years old and have always had uneven eyelids. Can eyelid surgery be done to one eye only to fix the asymmetry? Recently I thought maybe it was due to a lacrimal gland ptosis. It has been like this since I was a child. Can eyelid surgery be done to one eye only to fix the asymmetry? Does this appear to be a lacrimal gland ptosis?
Thank you for your question. You submitted a photo and a question about the situation with your eyelids, and you state that you've always had asymmetrical eyelids, and you want to know if you can have surgery done on one eyelid to improve the symmetry. You stated that it's been present since you were a child, and you also question whether or not this is related to lacrimal gland ptosis. So I think I can help you with this question. To give you a little bit about my background, I'm a board-certified cosmetic surgeon certified by the American Board of Cosmetic Surgery. I'm also a fellowship-trained oculofacial plastic surgeon certified through a fellowship done through the American Society of Ophthalmic Plastic and Reconstructive Surgery, ASOPers. And this is an organization that trains physicians in specialized, more advanced eyelid surgery because there's a clear need for this type of specialty in the broad field of plastic surgery. This is in contrast, just to give you a little distinction, between a general plastic surgeon who is not specialized, who's done a 2-year residency and learned a little bit about everything head to toe, but unless they do a specialty fellowship, doesn't have as much experience before training as an oculoplastic surgeon, just to make a distinction of the types of training there is in this field. I've been practicing in Manhattan and Long Island for over 20 years, and so as an expert in eyelid surgery, I can tell you that, first of all, it is possible to do one eyelid in order to try to optimize the symmetry. But if I can give you a little bit more information about the anatomy as I see it from this photo, the right upper eyelid just appears to be hooded, and the left upper eyelid has a more high crease. At the same time, there's a little fold of skin. So what I suspect is the case is that in some ways similar to Asians who have asymmetry in their creases, is that the eyelid in the right side doesn't have as good a connection between the skin and the muscle called the levator muscle, which defines the crease in the eyelid as compared to the left upper eyelid. There also may be some asymmetry in the volume of fat. Now, to address the question about the lacrimal gland ptosis. Well, the lacrimal gland is on the outermost or the lateral aspect of the eyelid, where it sits in a place called the lacrimal fossa. And when it prolapses or goes down, it can contribute to fullness on the outer aspect of the eyelid. Now, in order to really be able to tell that, you have to do a physical exam, and in addition, to make that distinction, I always have the patient look straight and then have them raise their eyebrows. And you can often see the outline of the lacrimal gland. Sometimes it's something we see in surgery as an incidental finding that helps us customize the surgery. One of the things we actually do is actually resuspend the lacrimal gland. A common technical error made by less specialized doctors is they'll often cut out the lacrimal gland, or they'll ignore it altogether, and the patient will still have some prolapse, and they'll wonder why they still have fullness on the outside. We've seen this many times. So from the photo, it doesn't appear that you have an obvious significant lacrimal gland prolapse. But again, a physical exam is necessary in order to make that distinction. I would say that it may be worthwhile for you to consider bilateral surgery or surgery on both upper eyelids, because with the right upper eyelid you can create a nice smooth platform, and then it might make the left upper eyelid look like this extra fold it still makes you look a little bit of with a little asymmetry. So this is something that requires a proper examination by a qualified specialist. I would say that it is best for you to now meet with qualified, experienced doctors who specialize in eyelid surgery, who can make this distinction. I would say also lean towards people who particularly specialize in cosmetic. There is a distinction. Someone like myself who specialize in cosmetic oculofacial plastic surgery, my practice is very different than a more of a broader-based oculoplastic surgeon who deals with a lot of functional, who deals with a lot of older patients versus younger, more aesthetic-focused patients. So it's just a matter of you feeling comfortable ultimately. So I hope that was helpful. I wish you the best of luck, and thank you for your question.